Hello, everyone. My name is Kayla, and I work with Miss Belinda Meadows, our Georgia Ship coordinator, as a Georgia Ship counselor. As you may know, the General and Medicare Advantage open enrollment just ended on March the 31st, but I want to briefly talk with you today about another enrollment period that is coming up if you are about to be turning 65. This enrollment period is known as the initial enrollment period. The initial enrollment period is a 7-month period when you first become eligible for Medicare and can enroll for Original Medicare, which is Part A hospital insurance and or Part B medical insurance coverage, or you could get a Medicare Advantage plan, which is Part C, or a prescription drug plan, Part D. But I do want to warn you that if you don't sign up for Part B, which is your medical insurance, when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. So when can you delay your Part B coverage? So if you're turning 65 and you're still working and you have health care insurance with your employer, or you are currently covered by your spouse's health insurance, then you may be able to delay enrolling in Part B as of right now. Now, what if you're unsure whether or not you should delay your Part B enrollment? If you're unsure if you should delay enrolling in Part B coverage, you can call Miss Belinda Meadows, our Georgia Ship coordinator, at her direct line at 678-552-2839, or you can call 1-866-552-4464 and select option 4 to receive one-on-one counseling session, and they will be able to assist you as well. So now that we've talked about that piece of initial enrollment, let's get back into what is the 7-month initial enrollment period actually is. So I have several scenarios of enrolling during the 7-month process, and I know it can be quite confusing. So I'll give you a few examples to help you better understand. So the 7-month period for initial enrollment begins 3 months before you turn 65, includes the month you turn 65, and ends the 3 months after you turn 65. So an example of this is, say that you turn 65 in June. You have 7 months from March through September to apply for Part A and or Part B coverage. So let's say you sign up for Part A and or Part B during the first 3 months of your initial enrollment period, which in most cases your coverage begins the first day of your birthday month. However, your birthday is on the first day of the month, your coverage will not start until that prior month. So again, an example would be you're turning 65 on March 1st, and you sign up for coverage in February, which is the first 3 months of your enrollment period. Your coverage will not start until April due to your birthday falling on the first day of March. Well, what if you sign up for Part A and or Part B the first 3 months after your birthday? So your coverage will start that next month. So you turn 65 on April 15th, and you sign up for coverage in June, which again is those 3 months after you turn 65. Your coverage will start the following month in July. So now that you have signed up, you may want to know, what if you're not satisfied with the plan that you chose and you want to be able to change it? So I do want to let you know that you can change it, and it's important to choose a plan that is best for you and your needs. You can make any necessary changes during the open enrollment period, which is from October the 15th through December the 7th of each year. During this open enrollment period, you can join, switch, or drop a Medicare drug coverage or a Medicare Advantage plan with drug coverage. And your new coverage will begin January the 1st, as long as the plan you're wanting gets requested by December 7th, which is when that open enrollment period ends. Again, that is October 15th through December the 7th. And during that time, if you are unhappy with the plan you chose, you can join, switch, or drop a Medicare drug coverage or a Medicare Advantage plan with including drug coverage. So if you need any assistance to apply for Medicare for the first time, you're wanting assistance with comparing plans, or you're needing advice to find which plan is right for you, or if you're just wanting to change your plan, please call Three Rivers Area Agency on Aging Georgia Ship Coordinator Miss Belinda Meadows at, again, her number is 678-552-2839, and that is her direct line. Or you can call SHIP at 1-866-552-4464, and you can select option 4 to speak to one of our certified Medicare SHIP counselors. Thank you. Have a great day.